Doctors say a new drug just approved by the FDA is a potential game changer for those at risk of deadly allergic reactions. The drug is billed as an alternative to injectable products like an EpiPen, and it's the first of its kind.
This is big news because millions of Americans suffer from severe allergies to foods and other triggers. Fox 5's Tyler Fingert is live in DeKalb County with the details on this. Tyler, this could really impact a lot of people.
Yeah, Courtney, good evening to you. When someone is having a life-threatening allergic reaction, doctors tell them to grab epinephrine, and historically that has meant that you have to inject it. But now there's a new option that has doctors and patients excited. Allison Park knows the danger she faces if a fire ant stings her because an allergic reaction is basically guaranteed.
Having a severe allergy is really intimidating because you always kind of need a plan.
Earlier this month, she had to put that plan into motion after a fire ant was able to sting her foot and she started having a reaction.
I have been a nurse for 15 years and I have a child with a severe allergy, and I still kind of panicked at the thought of giving myself an epi shot.
That concern about the needle needed to deliver life-saving epinephrine is something that allergist Dr. Christopher Chu with Atlanta Allergy and Asthma hears from patients often. To help with that, the FDA just approved a new needle-free emergency treatment.
I think this is a game changer, and it's something we as allergists have been waiting for years.
The Neffy nasal spray is for adults and older children experiencing life-threatening allergic reactions known as anaphylaxis. Those reactions can be caused by food and insect stings, among others. Some of the life-threatening symptoms include trouble breathing, hives, and passing out.
I feel like in patients who are afraid of needles, having this intranasal spray, Neffy, will help reduce the activation energy, if you will, or the barrier to giving yourself this life-saving treatment.
Last year, the FDA delayed approving the drug pending more data. With the approval this month, the pharmaceutical company says a 2-pack will cost $25 with insurance or $199 without. For Park, this new option is interesting, and she plans to take a look once it's available.
And giving your child a shot is really hard. I've had to do it before. It's a whole different ball game. So I think something nasal for him, I would be much more willing to use it when needed.
And the pharmaceutical company hopes to have this available at pharmacies later this year. We're live in DeKalb County tonight. Tyler Fingert, Fox 5 News.
Welcome news for a lot of people, Tyler. Thanks.